Good evening.
Good evening.
Welcome to Talking Sugar with Dandy. Tonight we are so honored to have our speaker, Dr. Regina Buckley Dandy, who's going to talk about the effect of diabetes on the entire body. Dr. Dandy is from Jackson, Mississippi. She graduated from Jackson State University, and she did her medical training at Philadelphia College of Osteopathic Medicine. Dandy is a family practitioner, and she practices at South Coast Medical Health in Richmond Hill, where she resides. So, ladies and gentlemen, Dr. Regina Buckley Dandy, my daughter.
I always like to start off with something personal. How much more personal is that? Okay. This is my husband Ronald and my son Ron Jr. and that's Jim Dandy.
Number two.
Number two. All right. So today we're going to be talking about diabetes, and I'm a family doc, so I see a lot of diabetes. In fact, I've seen so much diabetes, I say to my son, oh Lord, when are we going to slow down in the number of folks being diagnosed with diabetes? And it just seems that the more, I don't know if it's because we check more, folks are coming to the doctors a lot more, or if it's because we haven't really quite got the message about how devastating diabetes can be and the importance of good diet and exercise and coming to the doctor and discovering it early on before it progresses. But, you know, we're doing a lot more because we know that diabetes is so costly and it affects so many folks, especially down south, Georgia. We lead in the number of new cases, and I got a slide up here and we'll look at that later on, in the number of cases of diabetes. Very prominent in the South. It's prominent all over the United States, but for some reason the South is a little bit worse. So there's a need for us to talk about it because diabetes is devastating. And when I talk to patients, I start here. I say, if you got diagnosis of diabetes, then you're 5 times more likely to have a stroke. So I start here with my head. Then I put my hands on my eyes and I say, the leading cause of adult onset blindness is diabetes. And then I put my hands on my mouth and I say, and if you have dental caries, cavities, and diabetes together, that increases your risk of heart disease. And then I put my hands on my neck and I say the vessels, the blood vessels that run in our neck and our body, they're more likely to be clogged if you have a diagnosis of diabetes, because diabetes complicates microvascular, which is the small blood vessels, and macrovascular, which are the larger blood vessel disease. And then I go here and I put my hand on my heart and I say, you're 3 to 4 times more likely to develop a heart attack if you have a diagnosis of diabetes. And then I put my hand on my stomach and I say, you're more likely if you have a diagnosis of diabetes, for the nerves in your gut to stop functioning very well, and so you get nausea and vomiting and reflux and heartburn. And then I put my hands down here and here because one of the leading causes of kidney disease is from diabetes, right? And then I put my hands down here and they say, oh Lord, what is she doing down there? But I put my hands down here because if you're a male and you have a diagnosis of diabetes, then it's one of the leading causes of erectile dysfunction. And also, there are big blood vessels down here. So those big blood vessels have a greater chance of clotting, right? And then I put my hands on my legs and I say, diabetes affects the legs. Well, how does it do that? Because the long nerves in your arms and your legs are affected by the diabetes. It causes peripheral neuropathy. So then you don't feel as well. You get pins and needles sensation, burning in your legs and your hands and your feet. Okay? You lose sensation if you step on something. That's the reason why we're always talking about checking your feet, making sure you keep your feet checked. Because we know that folks that have diabetes and they lose sensation, they can't tell if they've stepped on a nail or a piece of glass or anything. There's nothing more devastating than a diabetic who comes to your office and they've stepped on something and it was weeks ago.